Hey everyone, it's Lisa with livingwithasthma.net, and we're here with another Asthma House Call where we get to sit down with some of the very best doctors treating asthma today. Today we're here with Dr. Lisa Miller of Good Night Pediatrics, a pediatric urgent care center in Henderson, Nevada. Hi, Dr. Miller.
Hello.
We're so glad you could be with us.
Well, thank you. It's nice to be here with you today.
Now, just to start, for those parents who have never taken their child to an urgent care center, could you just explain what an urgent care center is and how it's different from an ER?
Sure. An urgent care center is obviously not an emergency room. It's a place that treats most of your everyday or minor emergencies, things that are not life-threatening, things that are not incredibly severe. And it's generally a place that you can get in and out of quicker than an emergency room. It's a place where typically your insurance copays will be less. It's usually a fairly nice atmosphere, and the physicians that treat you in an urgent care, especially here at Good Night Pediatrics, are all board certified just like they would be at an emergency room. It's just that the level of emergencies that we deal with here is slightly less than the life-threatening things that you would get in an actual emergency room. So things that you would think about taking to an emergency room specifically would be if any reason you feel your child's life is in danger or you ever feel you need to call an ambulance or anything like that. Severe breathing issues, a child who's turning blue and simply can't breathe, head injuries where there's a loss of consciousness, vomiting blood as opposed to just minor abdominal pain, fractures or injuries that have deformities to them, or actual chest pain. Those are things that are dealt with better in an emergency room. Urgent cares are for a little less urgent things like ear infections, minor asthma exacerbations, small lacerations, those things of that nature.
Now, for a child who has asthma, are there telltale signs that can indicate whether something is appropriate for an urgent care center versus an ER?
Certainly. If any reason, again, you think your child's life is in danger, if they have severe respiratory distress, things like they're breathing very fast, they're having abdominal breathing, where their stomach is breathing in and out very rapidly. They have retractions, which means you can see their ribs. They're breathing so hard that they're pulling on their ribs. They're turning blue. These are all things that would indicate severe respiratory distress that probably need an emergency room visit rather than an urgent care.